Usually, when we think about getting a quick cosmetic touch-up, say, like a little hyaluronic acid lip filler, it feels almost like running a routine errand.
Right, yeah, like
Yeah,
picking up dry cleaning.
exactly.
Yeah.
You just pop into a clinic on a Tuesday, maybe you're on your lunch break, and 30 minutes later, you're back at your desk. The cosmetic industry has spent decades, basically conditioning us to see that syringe as this simple, highly accessible fix.
We've really normalized the technology to the point where breaking the skin for a cosmetic benefit feels akin to getting a haircut or a facial. The perceived medical gravity is just incredibly low right now.
But take that exact same syringe filled with that exact same gel and move the injection site to a highly complex, incredibly intimate part of the human anatomy, specifically the anterior vaginal wall. Suddenly, that quick errand is at the center of a massive global medical debate.
Oh, absolutely. The stakes shift entirely the moment you change that anatomical landscape.
Welcome to today's deep dive. We are looking at a huge stack of sources today. Guidelines from the UK's General Medical Council, the American College of Obstetricians and Gynecologists, and some really intense licensing consultations, and they are all just waving massive red flags.
Yeah, what we are seeing in the source material is this profound gap. A gap between how this procedure is marketed to you, the public, and how the medical and regulatory communities actually view the underlying risks.
So today, we're focusing on a rapidly growing procedure known as the G-shot, or G-spot amplification. Our mission today is to cut through the marketing and answer two vital questions that are currently tearing the industry apart.
Right.
First, who is actually permitted to perform this treatment? And second, why are regulators suddenly demanding a rigorous mandatory consultation before anyone even touches a syringe?
Well, to understand the tension over who gets to do this, we first have to look at the biological mechanics of what the G-shot actually is, because it's heavily marketed as a non-surgical plumping mechanism.
Okay, let's unpack those mechanics. A provider takes a dermal filler, usually hyaluronic acid, which is, the exact same compound you'd find in facial fillers like Juvederm.
Exactly. Or sometimes they use collagen or platelet-rich plasma, known as PRP.
Right. And they inject this material directly into the anterior wall of the vagina, targeting the Grafenberg spot. The whole goal is to temporarily increase the physical size and sensitivity of this erogenous zone to basically enhance physical pleasure.
Yeah, and the biology here relies heavily on the properties of hyaluronic acid. It is hydrophilic.
Which means it draws in water, right?
Spot on. It naturally draws in and binds to water molecules. So when it's injected into that specific mucosal tissue, it creates localized tissue expansion. It literally creates a physical bulge.
Okay.
And the theory is that this larger surface area increases the probability of contact and friction during intimacy. But because your body naturally metabolizes hyaluronic acid over time, it's temporary. It generally fades after 4 to 12 months, depending on, your baseline metabolism.
So on a clinic's website, that sounds incredibly straightforward. But then we look at the provider landscape in our sources, and the reality is utterly chaotic. It's like the Wild West.
It really is.
You have board-certified plastic surgeons, specialized gynecologists, and urologists offering this injection. But right next door, you might have non-medical, quote-unquote, aesthetic practitioners offering the exact same shot.
And that's because in many jurisdictions, the regulations simply haven't kept pace with these off-label anatomical applications.
Right.
Because these fillers are frequently classified as medical devices rather than highly restricted prescription drugs, the legal parameters dictating who is allowed to inject them are just remarkably loose.
Wait, help me understand something here. If hyaluronic acid is safe enough that estheticians inject it into cheeks and lips every single day, why does moving it a few inches downward suddenly trigger regulators to, treat it like major surgery? Why this sudden panic?
It all comes down to the underlying real estate. The facial dermis is entirely different from the mucosal tissue of the anterior vaginal wall.
Okay, how so?
Well, when you inject the pelvic region, you are working millimeters away from the urethra and the bladder. This area is packed with a dense, highly intricate network of nerves and blood vessels. It's far more complex than the tissue over a cheekbone.
But if you're scrolling through a clinic's Instagram feed, you aren't seeing a map of that vascular network. You're just seeing a flashy before and after.
Exactly, and that visual simplicity completely masks the severity of the complications. The sources cite very specific, severe urological risks if the injector doesn't perfectly understand that pelvic anatomy.
Like what? What's the worst case scenario?
Well, for example, if the filler migrates even slightly, it can physically compress the urethral tube. It acts like a dam, causing acute urinary retention where the patient literally cannot empty their bladder.
Oh, wow. That's terrifying. And the sources also mentioned hematuria, right?
Yes, exactly. If a needle perforates one of the many vessels in that highly vascular lining, it can cause internal bleeding that leaches directly into the urinary tract. And then you have the risk of severe nerve damage. There are documented cases in the medical journals of patients developing a constant, highly uncomfortable feeling of sexual arousal.
Wait, really? A constant feeling of arousal?
Yes, it's called persistent genital arousal disorder. And it happens simply because the filler was placed incorrectly and is permanently pressing against a nerve cluster. It's incredibly distressing for the patient.
So it's like trying to navigate a dense, completely unmapped minefield blindfolded,
Yeah.
1 millimeter off, and you aren't just getting an asymmetrical lip, you are hitting a critical internal structure that completely disrupts your basic bodily functions.
Right. And that structural risk is the absolute catalyst for the current public debate. The UK licensing consultation documents in our sources highlight this fierce division between what the public refers to as medics and non-medics.
Yeah, I found the public comments in those consultation documents genuinely surprising. You have patients fiercely advocating for the non-medics.
They do, yeah.
They argue that aesthetic practitioners often have a better eye for beauty harmonization. They claim non-medics take more time, they're more empathetic, and less rushed than a typical medical doctor.
And that's a valid patient experience. But the counter-argument from healthcare professionals is that relying on an eye for beauty is fundamentally negligent when you are dealing with internal mucous membranes and nerve clusters.
Empathy doesn't fix a blocked bladder.
Exactly. Empathy does not teach you how to resolve acute urinary retention. I mean, if an aesthetic practitioner injects a lip and hits a vessel causing a bruise, there are standard protocols.
Sure.
But if they inject the vaginal wall and trigger a urological emergency, they just do not possess the medical training, the diagnostic skills, or the prescription privileges to manage that crisis.
So if hitting a blood vessel in the lip causes a bruise, but hitting a nerve cluster in the vaginal wall causes permanent urinary retention, suddenly relying on an esthetician's eye for beauty isn't just risky, it's genuinely dangerous. Is that why major bodies like the General Medical Council are stepping in to overhaul the rules?
Precisely. They are attempting to pull the entire procedure out of the cosmetic tier and firmly into the medical tier.
Making it way stricter.
Right. The UK government, guided by the GMC and groups like the American Board of Cosmetic Gynecology, are proposing that genital augmentation using fillers be classified as a surgical, high-risk, quote-unquote, red procedure.
Classifying a 90-second injection as a red procedure has to change the entire business model of these clinics.
Oh, completely. Under these proposals, the procedure would be strictly restricted to appropriately trained specialist surgeons or fully qualified GMC-registered medical doctors.
So no more popping into a pop-up tent for a shot.
Exactly. Furthermore, in the UK, it would have to be performed out of premises registered with the Care Quality Commission, the CQC. You could no longer get this done in a back room at a local beauty spa.
You know, I was reading the American Board of Cosmetic Gynecology guidelines, and I was actually shocked by the legal trap here in the U.S. It's not just about medical licenses, it's about corporate ownership.
The CPOM rules, yes.
Right. Tell me if I'm understanding this corporate practice of medicine doctrine right. If an entrepreneur owns a med spa and they just hire a contracted medical director to sign off on the charts, the state can view that entire operation as illegal.
Your understanding is spot on. The corporate practice of medicine doctrine exists in several U.S. states, specifically to prevent non-physicians from interfering with medical judgment.
Oh, interesting.
The state views it as a massive liability issue. If a clinic is owned by a non-physician corporate entity, that entity might prioritize profit-like pushing high-volume G-shots over patient safety.
Which makes sense. They want to sell more units.
Exactly. So by enforcing CPO rules, the state ensures that a licensed physician is not only the one performing or supervising the high-risk procedure, but is also the one holding the ultimate legal and financial liability if something goes wrong.
They can't just hide behind a company name.
Right. They want to pierce that corporate veil, so a business owner can't just dissolve an LLC if a patient suffers permanent nerve damage.
Which brings us to the ultimate gatekeeping mechanism here. Because the stakes and the anatomical risks are so incredibly high, regulators are mandating that you can't just walk in, slap down a credit card, and demand the injection. They are legally requiring a rigorous consultation beforehand.
And honestly, the consultation is arguably more critical than the injection itself. It is the sole barrier preventing an inappropriate candidate from receiving a potentially harmful procedure.
And the physical aspect of this consultation is intense. The provider is required to conduct a rigorous pelvic assessment. They have to dive into the patient's full medical history.
Checking for active infections, right?
Yeah, local infections or underlying conditions like vulvar disorders, which would immediately disqualify the patient. And they absolutely have to rule out contraindications, like if a patient is pregnant or breastfeeding, the procedure is totally off the table.
But beyond just the physical screening for infections, there is a complex diagnostic distinction that must be made during this consult.
What kind of distinction?
The doctor actually has to diagnose the root cause of the patient's sexual concerns, because the G-shot only addresses one highly specific physical metric.
Right, it's just making a specific area bigger.
It is purely mechanical. It increases surface area to create more friction, but female sexual dysfunction is multifaceted. If a patient presents with a low libido or hormonal dysfunction due to menopause, or if their issues stem from emotional, relational, or psychological factors.
A shot of hyaluronic acid isn't going to fix any of that.
Exactly. It will not resolve the underlying issue at all.
You know, it's essentially like plugging a guitar with broken strings into a massive, really expensive amplifier.
Yeah.
You can crank the volume all the way up, but if the strings, like the hormones, the emotional connection, the baseline libido are broken, the amp just amplifies the static. You don't get music.
That is a perfect analogy. That highlights the diagnostic gap perfectly. A qualified medical doctor will recognize those broken strings. They will realize the G-shot is clinically inappropriate and redirect the patient to therapies that actually address the root cause, whether that's hormone replacement therapy, pelvic floor physical therapy, or psychosexual counseling.
Whereas a non-medical practitioner might just sell the amp anyway.
Exactly. A practitioner whose only tool is a syringe of filler and whose revenue depends on using that syringe has a massive financial incentive to just do the injection.
But how does a clinic legally inject a facial filler into a pelvic organ if major medical bodies warn against it? Because looking at the sources, ACOG explicitly states that these procedures are, quote, not medically indicated.
They do.
And they heavily warn against claims of improved libido. The FDA has even issued strong warnings about energy-based devices and fillers marketed for vaginal rejuvenation, citing a total lack of robust long-term clinical data. So how's it happening?
They operate through a concept known as off-label use. So the FDA regulates the marketing and initial approval of a drug or device for a specific purpose, in this case, facial tissue. But once a product is FDA approved, a licensed physician can legally use their medical discretion to apply it to a different area of the body if they truly believe it will benefit the patient.
That seems like a massive loophole.
It does, and it shifts the entire burden of liability directly onto the physician. And because of this lack of long-term data, the consent process during the consultation must be exceptionally rigorous. The provider must explicitly explain to the patient, verbally and in writing, that this is an off-label use.
And if you're the patient, that consultation isn't just about your physical anatomy. It's actually a deep dive into your psychological state, too.
Oh, heavily.
Yeah, the guidelines from the UK's GMC and the Royal College of Surgeons mandate that doctors assess if a patient is psychologically vulnerable. They have to screen for body dysmorphia. And crucially, they have to actively look for signs of external coercion.
Coercion is a massive and often overlooked factor in genital cosmetic procedures. One of our sources, a clinical study on female genital cosmetic surgery, noted that up to 32% of certain vaginoplasty and augmentation procedures are conducted specifically to improve a partner's sexual pleasure rather than the patient's own experience.
32%. That is a staggering statistic.
It really is.
It completely changes the context of the consultation. The doctor has to look the patient in the eye and determine if they are in that chair for themselves or because a partner is applying pressure.
Right. It requires high-level psychological screening. And, the pressure doesn't just come from partners, it comes directly from the market itself.
Advertising, yeah.
To protect patients from high-pressure sales tactics, regulators are implementing strict rules around marketing. Providers actually face the loss of their medical licenses for offering aggressive inducements, things like 2-for-1 deals on injectables or time-sensitive discounts.
It's wild to think regulators have to explicitly ban buy one, get one free genital injections.
Oh.
But if you look at how these clinics advertise on social media, it's just endless promotional discounts.
Yeah, it's everywhere.
And to counter that dopamine hit of a flash sale, they are also mandating quote-unquote cooling off periods, right?
Yes, the cooling off period is a mandated pause. Depending on the exact procedure and the overseeing regulatory body after the initial consultation, the patient cannot be treated on the same day.
I have to go home and think about it.
Exactly. They are sent home for a mandatory window. This ranges from 24 to 48 hours for certain injectables, up to 2 full weeks as recommended by the Royal College of Surgeons for cosmetic surgery.
That's a long time.
But the goal is to ensure the patient has time to absorb the medical risks away from the clinical environment, completely free from the pressure of a salesperson or the allure of a limited time offer.
They are legally forcing the process to slow down because consumer demand is just moving at lightning speed right now.
And the UK Parliament committees actually addressed this rapid explosion in demand in our sources. They refer to it as the Love Island effect.
The Love Island effect.
Yeah.
So we are talking about the impact of reality TV and influencer culture.
Exactly. We are seeing a fundamental psychological shift in how the public views medical procedures. Historically, medical interventions in this area were about restoring function, perhaps after childbirth or trauma.
Right, a medical need.
But now the paradigm has shifted toward hyper-optimizing anatomy. The committee noted that seeing reality stars casually discuss these cosmetic enhancements on television has basically stripped away the perceived medical risk.
Because it just looks like another beauty treatment.
Yes. A decade ago, these treatments were incredibly niche. Now, because social media flattens the distinction between a risky medical procedure and, like, a new skincare routine, demand has surged globally.
And whenever there's a massive surge in demand and a lack of clear regulation, someone is going to step in to capitalize on it. Always.
And the Parliament source explicitly states that this surge led to a race to the bottom of more and more practitioners filling a void of need and a race to the bottom of cost and price.
So people are just bargain hunting for surgical procedures.
Yeah. You had underqualified practitioners taking weekend courses, suddenly offering complex anatomical injections at cut-rate prices. And that race to the bottom is the exact reason regulators are now trying to hit the brakes hard.
Making sure only the pros do it.
The mandatory consultations, the cooling-off periods, and the push for medic-only classifications are all direct responses to this unchecked commercialization.
You know, if you're a patient looking for a quick fix, these new regulations might feel like a bunch of unnecessary red tape. But when you synthesize all the guidelines from the GMC, ACOG, and licensing boards, the picture becomes incredibly clear.
Very clear.
The G-Shot might be marketed as a 15-minute lifestyle enhancement, but it sits at the absolute center of a battle between commercial aesthetic trends and the fundamental medical principle of do no harm.
The consensus is shifting heavily away from convenience and towards safety. The regulatory bodies are asserting that the profound complexity of the pelvic anatomy and the severity of potential complications like urinary retention and nerve damage vastly outweigh the convenience of getting a quick shot at a local med spa.
It's just not worth the risk.
By demanding that only highly trained medical doctors perform these procedures, and by mandating ethically rigorous consultations, they're attempting to reestablish a baseline of patient safety.
Whether you are researching this procedure for yourself or you are simply fascinated by how social media trends collide with medical law, the core takeaway from this deep dive is that minimally invasive does not mean minimal risk.
That is the key point.
Just because a procedure doesn't require a scalpel doesn't mean it doesn't carry profound life-altering consequences if placed in the wrong hands.
Which leaves us with a broader question about the future of cosmetic medicine. If the aesthetic industry continues its trend of inventing new off-label uses for common products, constantly pushing the boundaries of where we can inject a filler, will regulatory bodies always be stuck playing this dangerous game of catch-up?
That's a great question.
Or are we inevitably moving toward a future where undergoing any cosmetic procedure, no matter how normalized it appears on social media, requires the exact same rigorous psychological and medical vetting as major invasive surgery?
It's a heavy thought to end on. Because at the end of the day, you wouldn't let a mechanic blindfold themselves before they start tinkering with a highly complex, incredibly delicate engine. Some machinery simply requires an expert who knows exactly what happens when things go wrong. Thanks for joining us on this deep dive. We'll see you next time.